good afternoon, good evening, good morning, depends on where you are connected. My name is Emmanuel Adigbola, and I'm so excited to welcome you to today's show, Kina Ed Show. Today's show is going to be very fun, very interesting, and I promise you it's going to be very resourceful as usual. So I'm not alone right here in the studio. I have patterns of mental health that's going to be demystify the topic, and I promise you will get values for your time today. So join me to bring in our guests even as they introduce themselves. I'm going to start all the way from Nigeria. So Dr. Bright, go ahead and introduce yourself to our audience today.
Thank you, Dr. Emmanuel. Bright Ugochukwu is my name. I represent David Omenoko Foundation here in Nigeria, and I'm glad to be on the show. Thank you.
Awesome. Welcome. So over to you, Dr. Selena.
Hello, my name is Dr. Selena Egamasi. I'm a family nurse practitioner and a psychiatric nurse practitioner. I'm dual certified, and I reside here in McKinney, Texas. I see mental health patients in the Frisco area.
Awesome. Good to see you. And of course, we have a second guest. I'm not qualified to introduce him, so let him introduce himself to our audience.
Hello, it's nice to be with you guys. My name is, for the purposes of the conference today, my name is Eddie Oswago. I've been in practice for nearly 26 years, contracted with both the government and private industries. I've practiced in several areas of mental health, both residential, private, and industries. I'm also a consultant. So that's what I do here in Mesquite. I live in Mesquite as well. Been here for 21 years in Mesquite, having lived several places in Dallas County, Texas.
Awesome.
Thank you very much.
Awesome. Good to see you. Wow, 21 years. That was around the time I was born. Good to see you. Okay, join me to bring in the co-host of this show, Mr. Alex. Go ahead and introduce yourself to our audience.
My name is Alex Mwahiri. I am a facilitator of the David Omenoko Foundation, both here in the United States and in Nigeria, and I am a co-host of this program. You are welcome to the program.
Awesome. And to all our audience, both on YouTube and on Facebook, we say a very big welcome to you. And remember, this is not a radio communication. That is just a one-way communication, supposed to be two-way communication. So for us to be able to see your chat, your questions, please do me a favor. Make sure you go to www.streamyard.com/Facebook, especially if you are connected from Facebook. So with that, you will be, given our Facebook authorization to share your comment. And with that, you'll be able to share your opinion, ask your question, and of course, we'll be able to see your comment. Well, we standing ovation while we remain seated. Join me to welcome the host of Kina Ed Show. Why she brings in the topic, what are we discussing? Also welcome our audience. Over to you, Dr. Kina.
Hello, everyone. This is Kina Menokoro. I'm a family nurse practitioner in Mesquite, Texas, and your host. Welcome from all over the world, our audience, Germany, London, Nigeria. Welcome to this episode of Kina Health Show. The topic today, we want to talk a little bit about mental health. There is a growing recognition that adverse life experiences due to a variety of reasons underlie of both psychiatric and medical conditions, and it affects us in so many ways. Today, we are going to discuss those challenges, the challenges we face every day, and how it affects our life, especially our mental health. This is important because most times we tend to forget in how these life experiences, even though they shape what we are, whom we are, what we become, but it also affects our mental health, leading to so many issues that if it's not dealt with, that we end up with medical and mental conditions that affect our everyday life. So today, I am privileged to have my two mentors here, Dr. Selena and Sarah Edi Osawu. So they are going to dive into this topic and help us demystify and give you some information that you can use every day to balance life and to prevent, further deterioration of our mental health in the society. Welcome to the show.
Awesome, awesome, awesome. So, once again, you are welcome. And please remember to share this video, either you are watching live or you are watching the recorded version. It doesn't matter. It doesn't cost you anything, less than 1 second. Just click and share. So, I'm going to be handing over to the co-host, Mr. Alex himself, and the host, why they host the guest. Over to you, Mr. Alex.
Yeah, Dr. D, we are going to start right away. But before we go into demystifying mental health to the ordinary person, I want you to establish for us what you may consider to be life changes that can impact mental health. When we establish that and we establish what mental health is, then we get into demystifying the subject. Thank you.
Yes, life changes occur when life is no longer flowing the way it's supposed to flow. When somebody has issues with their job, with their families, when people have medical issues, they don't know the source and causes of it, when people cannot take care of their basic daily lives. That's a change right there. Things are no longer the way it used to be. Things are no longer the way it is. Things are happening that they cannot understand, they cannot explain. Family members will tell you, this is not the AD I used to know. This is not that person I used to know. At that point, you can obviously see that there's a change. You can see that life is now in a roller coaster. And we work to establish the fact that we can turn things around. Things can turn around. Thank you very much.
Dr. Gamase, you may want to contribute yours. Let's lay the basis.
What are the life changes that can happen? Like, for example, divorce is a life change that can affect mental health. Marriage is another life change. Possibly going to jail. Major stressors in life changes can affect mental health. Um, Maybe having children can affect mental health, like such as, women go through postpartum depression. That is a huge life change. Financial difficulties is a big life change. So all of these things can affect mental health.
I also want to add that even students going through school, I think the statistics show that most of these patients that have schizophrenia between the ages of 25 and 34, when schizophrenia actually manifests in adults. So there are several reasons. Some happy occasions, can bring you stress, and stress, can lead to mental health issues. Just wanted to add those too.
Yes.
Just before Mr. Alex continues, I just want to direct a question to Dr. Selena. Standing looking from the perspective of a layman, or should I put it a Christian? Because those factors that you mentioned look like a good things of life. So how does it contribute to mental health? Somebody get married, somebody having baby, somebody, having even promotion, having good things of life. So how does that contribute to mental health issue?
That's a very good question. So a promotion, for example, like as you asked. some people experience this thing called imposter syndrome. Like they don't feel like they deserve to be promoted, or they don't feel like they deserve to be in this perfect situation that they find themselves in. And that right there is almost like sabotaging all the work that you've already worked for. It's just self-sabotaging, thinking of the worst thing that can happen, thinking of possibly I will never do well, I will never be good enough, or even though I have all this stuff, I'm still not good enough. For example, again, with the children, women have hormonal changes that could affect your mental health after giving birth to babies. It's just a woman's body goes through changes. So that right there, if there's not good support at home, if there's not someone that they can talk to, if they feel that they're waking up in the middle of the night to help the baby change the diaper, all these new things, losing sleep, not eating and trying to breastfeed, and that right there is another mental health. It can attack your mental health. So it's just life changes. Any life change, whether it's good or bad, can attack your mental health. So yeah,
Like
hormones.
someone that is a figure eight all of a sudden get pregnant and have an anxiety that my shape is going to change.
No, yeah, just or yeah, because that's another body dysmorphia. You'll think that you'll never get back to your pre-baby weight, right?
Wow.
And yeah, it's a thing that women, we don't really talk about it, but it's a problem. Breastfeeding is a huge thing where you feel like you're not giving enough milk to your baby, you're not producing enough, and then it starts to mess with your, oh, I'm not good enough, I'm not a good mother, I'm not doing my best. They say I need to breastfeed, I need to. So it's society
Even
too.
if you are breastfeeding, the anxiety can come that wow, the shape might change, right?
Yes, I mean
Mental. Okay.
that's part of the body dysmorphia.
Okay, before we go far, let me hand over back to Mr. Alex. We'll come back.
Yeah, like I said, before we get into the nitty-gritty of the whole thing, let us also establish what do we really mean by mental health? Can you give us a picture so that we can understand? And before we begin to link the two. Dr. Egemasi, I want to start with you this time around.
What do we mean by mental health? The
Mental health,
definition?
yes. Yeah, how do we explain it?
Well, it is a chemical. It's like a chemical disorder in the brain. So basically, we have neurotransmitters, and some people lack some people have an abundance of some. And these neurotransmitters either help you to be happy or, sad or anything like that. So when someone has a decrease in those neurotransmitters, of course, you get on medications or go to therapy to help with that. So mental health, there's depression, there's anxiety, there's bipolar disorder, there is personality disorder. There's all kinds of disorders. Schizophrenia, where you hear voices, see things, hear things that are not there. There's also mental health issues from drugs. If people are using drugs, you can be induced from alcohol and drug use into a manic state. So, I mean, there's a lot of mental health is real. Some people think it's not, as the devil, or whatever you might think, but this is a chemical imbalance that deserves treatment, just like diabetes, high blood pressure, and high cholesterol.
Okay, Mr. Alex, I'm going to hold this for a second. When it comes to internet, it's a prayer point in Nigeria. So we have one of our guests from Nigeria, and right now that the internet is still cooperating, the light, electricity is cooperating, and he himself is still smiling. I think we need to get to him quickly before we continue. In the month of October is a big month for David Domenico Foundation, and that is why we have Dr. Bright in the house. So, Dr. Bright, will you kind of update us about David Domenico Foundation, what is going on in the month of October, November, December, if possible, and how does that integrate to this show, and what do you expect from us and from our audience? Over to you.
Okay, thank you very much, Dr. Emmanuel. David Domenico Foundation has started again for the month of October, but prior that, we have also expanded our course for consultation on basic life support, CPR, and first aid packages for people, because we understand that a very reasonable percentage of death here could be prevented, but because nobody knows what to do, and people will just allow their loved ones go like that. So the foundation has decided to create a package for that, and we're calling on people to come get this training so that they could help solve their loved ones. Now, next on the line is the mammogram program we have been doing free of charge. We are also calling on people to save one soul, saves one soul by supporting to give people free mammogram. The report and the most of the testimonies from last year's screening have been trailing, and people with severe cases we referred last year, we are monitoring them, and at least they are breathing sigh of relief. So we are calling on people this month again from 22nd of October. Before 22nd of October, we have launched our GoFundMe from website link. You can save one person from breast cancer. And when you are in a situation, first of all, the economy is bad. There is no money for you to get a chemotherapy. There is no adequate health facility. Right, as I speak with you right now, the health industry here on industrial action for the past 2 months, if I'm not mistaken, and there is no sign of resolving it. So if there is any pending case that may lead to death, be sure the person will die. So the issue that you can save somebody means a lot to this program we are doing. First of all, you're going through the process of not having the funds to acquire what you need. Secondly, even if you have the funds, there is no adequate health facility for you to access what you want. Thirdly, there is the hike of food prices are going high. So there are many challenges that could affect the mental health here, not just only those that degraded into the street. So this is what we have mapped out for this October program, and this is what we want to do. Thank you so much.
Wow. So even talking about mental health, what we just talked about right now is what could affect mental health of so many Nigerians and loved ones abroad. Because if your family member is in Nigeria and you think their mental health is in a good position, but because of lack of food, lack of good medical issue and process, wow. Well, thank you so much. Thank you so much, Dr. Bright. I don't know if Dr. Kina has anything to say before we continue. And by the way, you're watching this, if you have to go to Nigeria to volunteer, you will buy your ticket, you will lodge yourself in a hotel, you will eat food for those days, but you don't have to go. In fact, by the way, we don't want to bother you. All you have to do is send your money. So you can just, Zelle, you can cash up. If you want to drop cash, you can drop cash. We'll go show you the address of the foundation here in Dallas. But to make it easy for you, you can just go to GoFundMe, gofund.me / that is the number right there. Let your $5, $10, $100, $1,000, $10,000. How much is that to you? That will save a soul and save a life. Over to you, Dr. Kina.
Well, I was just going to add, talking about mental health. If we're here and we've got our loved ones back in Nigeria and they're not getting adequate care, we know. So screening is the most thing that makes sense to prevent any condition from coming up. We screen people back in Nigeria for breast cancer, we screen for prostate cancer, we screen for colon cancer, and general health, diabetes, and blood pressure and cholesterol. So we're asking for your support so that we can continue these screenings so that we can save the loved ones that we have back home. That's all for now. So we'll talk a little more on this.
Awesome, awesome. Welcome back from the commercial break. So over to you, Mr. Alex.
So, Dr. Oswago, I'm coming back to you. We've been trying to establish what mental health is before we get into demystification. So can you help us explain more on how we can appreciate what mental health is? Throw more light on.
Honestly, mental health to me is the foundation of health. Because when people don't understand what is going on with them, when they are not right upstairs, as we commonly say, they will not function very well. That is the root of most of the problems people have, because they do not know what is wrong with them. Somebody that ends up in the street, somebody that ends up jobless, somebody that ends up with relationship problems, somebody that ends up with all kinds of dysfunctionality. That is mental health issue. And once we understand that, the person is on the way to healthy lifestyle that will be very productive. Thank you.
Okay, so if we have to go from there, if you identify, how does one begin to know that he's having mental health problem? For like you said, most of the time you don't even know what is happening to you. You don't understand what is happening to you. So how do you get about it? How do you know the thing is developing? And for instance, if I have people that I'm living with and all of a sudden I'm not getting them, I'm not understanding what they're doing, do I begin to look for a mental health doctor? Dr. Sam, I'm still asking.
Sometimes these people don't know what is wrong with them. They don't know that they're sick. Their reality has changed. Their perception of reality is no longer what it used to be. Or more often than not, it is somebody close, somebody who can say, this is not the person I used to know. There is a very high level of denial. You are the one that has the problem, not me. Because that's their worldview, their mental pattern, their mindset has shifted. There's a state where we call modified brain chemistry. The brain is no longer functioning right. Their reality is their reality, which is contrary to the world reality, worldview. So more often than not, it is the loved ones who are around who can say, look, you need help. We've gotten people in our clinic who were forced by the government because they're in denial. They don't know what they're doing is wrong. We've gotten people from the families. Recently, we have too many young people say they have anxiety, that they can't go to school. To them, somebody's attacking them in school. In reality, nobody's attacking them. So the brain chemistry is no longer functioning very well. When the brain chemistry is altered, they behave according to the perception, which is contrary to conventional way of life, then you know something is wrong. That's when they need to get assessed, and they will make a determination of what kind of illness, mental illness they have. Thank you.
Dr. Selina wants to add to what I-Chiefs just said.
Yes, I agree with him. Most times they don't know. To them, they're normal. To them, they don't see anything is wrong with them. But I did my study, my dissertation at a primary care clinic, and because there's so much stigma towards mental health, the primary care setting, your primary care physician can be that open door for you. So if we will do simple, testing, PHQ-9s or a GAD scale, just simple questions, asking how their day is going and how they've been feeling. Right there, you can probably help the patient get the treatment that they need, especially if they score really high on those scales. So sometimes some people are not encouraged or motivated to go to a psychiatrist or to seek mental health because of stigma behind it. Of people, putting this label of, oh, something's wrong with you. So it's sometimes going through the primary care setting. Primary care setting is a big avenue for us to catch, these kind of illnesses. So.
I'm just curious as a pastor. Okay, I'm a pastor, right? And at the same time, co-host. Now, I want to look at it this in a spiritual aspect, if you guys don't mind. So how do you differentiate someone that has the how the way I Chief put it, imbalance upstairs? How do you differentiate this to someone that is going through spiritual attack? Do you believe there's anything of that nature?
Again, for correct purposes, I'm not a doctor. I'm a master of science, a licensed professional counselor, so that nobody comes out there and hold me responsible.
Okay.
So I'm a licensed professional counselor, master of science. Anyway, yes, there are cases where we establish that this is not mental illness. Mental illness is a spiritual issue. There are some people, you have done all that is that you need to do, yet you cannot identify what is going on. You can provide all your professional skills, yet they cannot get well. Since you say you're a pastor, even in the Bible, you saw where Christ said, this devil has possessed this person. Part of the work I do is I work with autistic young people and old people. There are some cases I see, there's nothing we do from the science point of view that can explain it. And also we know from practice that some people that what you have done your test, they don't meet the criteria. We use a book we call DSM-5. There are some people that can't meet that criteria. Either way you look at it, they can't meet the criteria. Even us in the profession recognize spirituality as part of reality of life. So yes, there's accommodation for spirituality in mental illness.
Awesome, awesome. Dr. Selena, do you agree or disagree with iChief?
Well, yeah. I try not to go that direction just because, you know, everybody's beliefs are different. But there is anything is possible.
Anything is possible.
Yeah, I just don't want, you know, like, because mental health is real. It really is. And it should be treated accordingly, you know. And like I do have patients that constantly hear voices, constantly hears, you know, things that we don't hear. And it's a constant thing for them. Sometimes they go about their lives with those noises. Sometimes, you know, they can't be productive in life. So this is a true illness. I mean, we don't want to misguide, you know. So.
Spiritualize it.
Exactly.
I mean, I got fired. I'm an LP, by the way, licensed vocational nurse, and I used to do pediatrics nursing. And I was posted to this case. This boy was normal till like age of 7 years old. And during summer, they said they were playing, and the boy just slumped and like that. So, and of course, being a Christian, and I was trying to just talk to this woman that, you know what, from where I came from, this is not ordinary, you know, for a child to be, okay, to the age of 7 and just slump, and from there can't talk, can't do this, and I was like, do you believe that this boy can recover? And the woman was just nodding her head. And when I closed my shift that day, she called the agency that never sent that guy back to us. His word that he's trying to pick a witch. Yeah. Anyway, I just try to digress so that, you know, we have most of our audience watching this program. They are from Africa. And when we're talking about mental health, trust me, Africans, they try to actually wrap it off their head. Okay, what are they talking about? You know, these are people that are very, you know, spiritual. These are people that are very religious. And so I just want to put it out there that, yes, there is a mental issue and also there's a spiritual issue. And you cannot use physical to treat spiritual, but you can use spiritual to treat most physical. Okay, I step aside, hand over back to Mr. Alex.
Yeah, Dr. Swagum. Now,
yes.
You talked about life changes and the way it impacts on mental health. And again, you have established that most times people who have mental health may not even know, they may not appreciate their problem. Now, can you be a little bit more elaborate and tell us how you normally trace a mental health patient to a life changes? How do you identify there are certain life changes that have affected him? And what are those life changes that are more critical in affecting mental health so that we can move from there?
A common one we see from our clients from VA, Veteran Hospital, is PTSD, post-traumatic stress disorder. These people have seen so much that they can't sleep. They have seen so much that they are restless. They can't get out of their house. They can't go to work. They think somebody else is going to kidnap them. I've had clients where around 6 o'clock, when it's about to be daytime, they use black blanket or black whatever black to cover their house so that they will not see the day, they will not see the light of the day. Once something like this is happening, obviously something has changed, something has happened. When you see somebody, when they go to work, everybody on the job is after them. Somebody's going to get them. They will never make it this time. They're going to be fired. Obviously, you can tell that something is wrong. Life has changed because they can't keep anything going well in their lives. So once you see this, we recommend that you see a professional. I hope that addresses the question.
Yes, it does. Yeah. Dr. Egemas, I want to ask you, what types of mental health issues are more prevalent in the society? Which are those that are regular and more prevalent?
Depression is huge. Bipolar. There's so many undiagnosed bipolar disorder patients out there. Just because, with bipolar patients, the major symptom they have is being able to manipulate people. So if you're not able to catch that, they can trick you into believing whatever they believe. So another one is borderline personality disorder too, is a big one, and trying to differentiate the two between borderline and bipolar disorder. So yeah, depression, anxiety, borderline personality, and bipolar.
Okay. Okay, go ahead. You want to talk?
Oh, she's on mute.
You are muted.
Can you highlight a little bit more on bipolar? Because, generally people don't even know what bipolar is. And also when they use bipolar, they use it as a joke. Oh, this person is bipolar. This person is bipolar. And not knowing that it's a serious mental health issue. Can you talk a little bit more about bipolar?
Okay. Bipolar is a mental health disorder that you can bi meaning two, right? So you can be either really really depressed or really really hyperactive or manic. So bipolar patients typically they don't sleep. It's the biggest symptom of bipolar. Like you can go probably 3 4 5 days with no sleep, not even an hour of sleep. That is a very critical symptom, which at that point they're at the manic stage, which is the most critical stage where they are probably hypersexual, or they're stealing, or they're spending thousands and a lot of money, and just being very manipulative. That's the manic side. But the other side of bipolar is the depressed side, where they can't even shower, get out of the bed. They stay in the bed for days on end, not wanting to do any self, hygiene care, which is brushing their teeth, showering, taking care of their house. So that was what bipolar is, and being in that situation for weeks at a time. We all get depressed, but most of us will get depressed and then get over it. But these people, they stay depressed for weeks, months on end, or they stay manic where they're hyperactive. They think they're invisible. They can do whatever they want. They can get away with anything they want. They can steal. They can sleep with different people. They can do all kinds of things and not realize what they're doing is wrong, because to them it's their reality. It's normal.
Thank you. That I think that sheds a lot of light that people are probably going, wow, we didn't know all of it, all of this.
Mhm.
Well, I'm going to come in another dimension again. I represent. I'm kind of trying to view this show from someone watching from Mbise or Ibadan or Lagos or Kaduna, and he's talking about depression. Does Nigeria really get depressed? Is there anything like depression among Nigerians?
Why not?
Really?
Yes.
Because I spent my first 29 years in Nigeria before I came to US. And to be honest with you, it was when I got to US I started hearing the word depression. I mean, everything we turned into comedy in Africa, in Nigeria, right?
Okay, so I guess the definition of depression is what we need to know.
Okay.
So feeling sad, right?
Mm-hmm.
So when you lose a loved one or something really bad happens, some people are sad for weeks, months on end, and they stay stuck in that sadness, that impending doom feeling where you feel that I've lost the most precious thing in my life and I can't move forward in my life. I can't do anything. My life is worthless right now. That feeling of that impending doom, that nothing ever is going to get better for me. That is depression. Staying stuck in that situation.
Yeah, I think Emmanuel was thinking about the horrible conditions, political conditions in Nigeria, economic conditions, and people don't care about it. People are moving.
Because with that, all the citizens should be depressed.
Yes, that's why he was only looking at.
Well, I want to add that when you have those feelings and it affects your daily living, you can't get out of bed, you can't go to work, you can't go shopping, you can't do anything, then that's depression. So I think that in a way answers your question.
Yeah, but what Emmanuel is saying,
we all get depressed.
Those things don't make people not move. Nigerians move, irrespective of what is going on. Bad roads, they move. Flooded environment, they move. Mosquitoes, they move.
Well, you think everybody moves, but there are people that don't move.
Yes, there are people that don't move, but they just started to come. Anyway, I just put it out there to show that what we are talking about, the topic affects everybody. Even Jesus was depressed.
Yeah,
even Jesus was depressed. So it affects everybody wherever you are that you are watching, and that is why you need to pay attention to the topic, and that's why you need to share this video with somebody, because somebody that you think that, okay, this person is all right, he's okay, trust me, that person is going through depression. The only problem is that we don't just know the name to give to it, and now you are watching this to understand the name that is being called. Okay, how do you want to explain someone that graduated with first class, 1 year, 2 years, 3 years, 4 years, 5 years, no job, and all of a sudden this person become a sadist? That is a chronic depression right there. But before we know it, we begin to go for deliverance and go for deliverance, instead of wake up to reality and understand that, hey, you are being depressed, and what do I need to do? And I think that takes us to the next questions to discuss. How can somebody realize that, okay, at what point does someone's wake up and raise up his or her hand that, okay, I think I need help?
Do they really understand what they're doing for them to begin to talk they need help?
Yeah, I mean, someone, you just discovered that, okay, you are having a mood swing, or you just discover that you don't just feel excited about life again, or you begin to feel like, okay, let me just end it. I think I can just kill myself. I mean, you begin to with define mental health right now. So at what point do you think someone or somebody that is saying somebody, okay, because sometimes they themselves might not feel it, that, okay, they need help. Maybe it's someone around them. At what point does that happen? I don't know if my question is clear.
Yeah, it's clear.
Okay, I saw you shaking your head, so please take it from there. Then,
at what point is your question that there's a problem when you're not able to care for your home, to the point where your kids are neglected, your family's neglected, or you're neglecting yourself, failure to thrive for your own self too. You're not eating, you're not taking care of yourself. When it gets that bad, of course, that's when someone needs to intervene. Well, hopefully before then, you know. So subtle changes, of like the things that they used to people like to do, like if you like to usually go and play soccer, if you like to usually go and cook, and you're not doing those things anymore, you lose interest in those things, or you're not paying attention, or just easily distracted, by little things or conversations. Those are like triggers and signs to get help.
Okay. Yeah, we have someone from Facebook, Joy. Joy says depression is trivialized in Nigeria. It does exist, however, not taken seriously because of other underlying economic, political, religious, and environmental situations. I added mine to it. Yes, so it happens.
Yeah.
Okay, I Chief wants to add to what Dr. Serena just said.
Yes, when it comes to a point where somebody realizes that something is wrong, then the person's mind is still functioning. In practice, we differentiate two types of clients: those who are psychotherapy needs and those who are counseling need. If somebody comes to my clinic and we determine that this person understands the issues, it's just that they don't know how to go about it, those people we can give counseling, and counseling will be effective. They've come to a crossroad, what we call impasse. They've come to a crossroad, they don't know if they're going to go left or right. When they come to us, we can help them sort it out. But once it is chemical imbalance, they may not be in position to know that that life is becoming an issue for them. So once they understand and they're able to say, look, things are not working well, what can I do? Then we can work with those people very easily. Those that have medical problem, as in chemical imbalance in the brain, those whose brain chemicals have been altered due to depression, anxiety, or even stress, those people are people we can say, okay, maybe you need to see my Dr. Kina, maybe medication will be in place now, maybe you see a psychiatrist. Point being, there are two types of mental cases we work with: those who need counseling, things are difficult, they understand that, they don't know how to go about it, and those who don't even know that they have mental problem. They blame the whole world, they can't see where they are going wrong, they don't see where they go wrong. Those people may see a psychiatrist or medication for chemical balance. Then we work with them from that point. Thank you.
Yeah, Dr. Samu, let us continue from there. You have tried to tell us what really the link between life challenges and mental health. But I want to believe that there could be two types of causes. One could be immediate and one could be remote. So if you were to classify what causes mental health, which ones will you consider the immediate and remote causes that triggers of mental illness and mental problems?
There are people who have genetic predisposition to have mental illness. It can come up at any time. Usually they can start at teenage years or later on. Those chemical imbalance, those genetic problem can come at any time, and you see it clearly. But those who have faced life challenges, say for example, somebody who is traumatized, say for example, all the riots going on in Nigeria, some people are being killed, some people don't know where their children are, some people don't know how to feed, some people don't know how to do one thing or the other. You can see where their problem is coming from. They cannot meet daily challenges. But those who have chemical imbalance as a result of chemical derangement in their brain, they need medication to adjust. So that's where we can begin to differentiate the two: what is immediate and what is immediate cause or remote cause. Remote, genetic, very possible. Immediate, you can see what happened. Somebody lost their husband, somebody lost their wife, somebody lost, their house got burnt, for example. It can be traumatizing. So you can tell when it's immediate and when it is genetic. when it is predisposition to have chemical imbalance.
Okay. Okay, so we have a question here that says, how does other chronic health condition lead to depression and anxiety? So I guess we need to look into those chronic health conditions. So what are those chronic health conditions that could lead to depression and anxiety?
Dr. Selena may want to go take that up.
Chronic health conditions. Oh, okay. So pain is a huge chronic health condition. You know, when you're constantly in pain, how can you be happy? You know, if your pain is constantly at a scale of 1 to 10, 10 being the greatest, a 10 or a 9 every day of your life, you sleep, you're in pain. You wake up, you're in pain. That is a what we call psychosomatic. Something that one of your comorbidities, which is which is the pain that causes your depression, or some people. I would say maybe the elderly. When you get older, you lose a lot of people around you. Everybody's passing on, and then you're alone, so that can cause depression. And then of course dementia, like being forgetful, and having some memory loss can cause depression, because then you go into denial, like there's nothing wrong with me. I don't know why I keep forgetting things, but there's nothing wrong with me. But that can cause depression, that you have to keep asking, what did you say again? What was that again? Oh, I don't remember. So memory loss. Even having diabetes, the fact that you're sick with a comorbidity such as diabetes or even high blood pressure can cause depression for some people. Uh, Being obese, weight gain can cause depression for some people. So those are chronic health issues, as well as cancer is a big thing that can cause depression. Living with cancer or living with, a chronic health conditions such as lupus, So all those things can cause depression.
I want to add to what Dr. Selena has said. There are some diseases also that have to be ruled out before we determine whether someone has some mental health condition, like head trauma, you rule that out. Someone that has thyroid disease, hyperthyroidism mimics bipolar or manic conditions, and hypothyroidism also mimic depression. So there's so many other diseases, but that's why, when you get your annual checkup, you go through your primary care doctor. They can screen you for different things, check your blood, and make sure, that your organs and other conditions are in check, and have all that ruled out before they dive into checking for mental health issues.
Awesome. I know our time is very, very fast spent, but trust me, I'm learning a lot, and I believe so many people out there are also learning. I don't know if Mr. Alex have a question, but I believe one of the questions we have here says, how can mental health be managed? And I guess we're talking about mental health. There are different situations, right, that contributes to this. So how can these be managed? And I'm going to put it in two-in-one questions. Can it be treated? Can it be eliminated totally? Can somebody look at himself or herself as, okay, I used to be this, but now I am this?
Yeah.
Anyone can take that out.
Sorry, who will take it? The question?
Yeah, you can take it.
Can it be eliminated? We hope so. That's
Yeah,
the hope.
like okay, you have a patient now. Is there any point in their life that you discharge them because they are okay now?
Oh, yes, I have discharged patients because they did so well after some treatment. My goals with all my patients, if we decide to go the medication route or the med management route, is at least 6 months to a year. Now, I always tell them never to be discouraged if you need to continue these medications, because what matters the most is having a functioning life. So you'd be able to be productive in life, right? So just because you're on medication doesn't mean anything. It just means that you do better with meds. Um, so can it be eliminated? That's the hope. But all hope is not lost if it's not, right? As long as that you're in a good steady path, then that's fine. The treatments that we look for, I always say, especially with kids, I like to start with therapy first. Therapy is very important. You can give someone all the medication in the world, but if you don't combine that with therapy, it's not going to work. The studies have shown that medication management with therapy go hand in hand, and it does very well for a lot of patients. So, I there's different types of therapy, which uh, I'm sure that Sir Eddie can explain to us of those specific treatments like CBT and DBT therapy and all kinds of therapy. But yes, um, the hope is that it gets eliminated, but if not, that's okay. Life goes on, and you can still have a good, normal life with medication and therapy.
Okay, over
Okay.
to you,
Uh,
Chief.
okay. In line with what the doctor said, once it is chronic illness, which may be organic, in other words, it is brain damage, the brain chemistry damaged, there may be medication for a very long time, including psychotherapy. Once it is situational, depression, situational anxiety, situational stress, we can identify what led to that situation. Once is reversed, once the situation is resolved, reconciled, you see them functioning very well all over again.
Mhm.
So we want to differentiate. Is this organic? Is it chemical imbalance? What we call chronic illness means a disease. Once the person has that disease, they got it. They got it for life, which is as a result of natural chemical imbalance that came to manifest at a particular time. But once it's situational, yes, people do overcome. We've seen people come to us to thank us and tell us, yeah, I used to be like this, I'm no longer like that. Those are people whose depression, anxiety are caused by situation. But those who have a chronic illness, defined chronic illness, that could be permanent. In other words, they're going to do medication and psychotherapy for a long time, and they'll be functional. They'll be very, very healthy people once they continue to take their medication and psychotherapy. Thank you.
Awesome, awesome, awesome. Thank you so much. It's been a wonderful session. We are rounding off, but before we go, we always take like a minute, like, okay, take home. But before we get to that, there is this GoFundMe that David Domenico Foundation sent out. And I would like to invite Dr. Kina once again to kind of talk about this. What is the purpose of this GoFundMe? Is it to go to African store to buy some Oporoko and Giz Dodo, or there is something that the foundation is really doing that will propel us to kind of support the mission and the vision and the cause of the foundation? Over to you, Dr. Kina.
Okay, so David Omenico Foundation for the last 6 years, we have been very active in both here in the US and in Nigeria. Every year, we usually take medical mission to Nigeria, and throughout the year, as a matter of fact, we do several activities. In February, we do World Cancer Day, and we screen people for various types of cancer. In March, we commemorate colorectal cancer awareness month. We provide free cancer screening. And during August meeting in Nigeria, we do all kinds of education, awareness. We even do vision screening and diabetes, hypertension. We do it all. So October is Breast Cancer Awareness Month. So I'm inviting everybody to support me so that I can screen 1,000 women in rural Nigeria that have no means of getting any type of screening done. So we did this last year. It was very successful. We screened 150 women in Imo State, and we're doing it again this year. So we're asking our supporters to help us achieve this milestone in our in David Domenico Foundation. And also this December we'll be carrying out medical mission where we provide different types of screening, and we offer medications, and we follow up with every community we go to. We just don't give them those medications and then go back. We go back and make sure that their medications are being refilled from time to time. So go support David Domenico Foundation, www.davidomenicofoundation.org. Thank you.
So let me quickly ask, okay, I live in Dallas and I have 8 sisters or 8 women or 8 mothers or 8 aunties or sisters back home in the East or the West or the North. Can I just send them to you guys and give them your contact? Or what is the requirement? What is the qualification? What qualifies somebody that you have to test, and how can we participate? Or because I just donated $100, that gives me enough reason to send as many people to you?
Well, I'm glad you asked that question. $100 will screen 2 women. So if you want to send 8 of your sisters or your cousins, just multiply it by 8. And but honestly speaking, this fundraising activity is to help those that have no help, those women that don't even have enough money to put food on the table for them and their children, not to talk about going to the doctor. There are some villages that they don't even have enough money to travel to the city of Owerri to get the screening done. So this year, we're going to incorporate in certain communities, we will take the bus to the community, take them to Owerri so that they can get their screening done, and we'll take them back. So help support this effort.
Awesome. And last, so I guess what I'm trying to say,
I wanted to add something to what Kina was saying.
Okay.
From your question, it is not just you sponsoring your people. No.
Yes.
You can sponsor your people, but you also have to understand that the aim is to help those who cannot help themselves, those who cannot find food to eat, those who cannot treat themselves, those who have nobody to help them. These are our targets. So if you have your people and you can pay for, you can add some more for those who cannot help themselves. Thank you.
Awesome. So in other words, if you have your family members that you also want to recommend that they are tested, you can just link them up with David Domenico Foundation, either Nigeria chapter or US chapter, and they give you the contact of how you can get your family tested at the subsidized rate. But what they are doing right now is seeking for your support, not because you donate $100 and you will now send 10 people. It happened last year and we don't expect it to happen this year. Thank you so much. We love you. Okay, so we're going to be rounding off the show for today. We normally take what we call take home. And once again, I just want to appreciate all our guests, Dr. Selina I. Chief. Thank you so much. So let's say someone is just connecting with us right now, and this person, you want him or her to just go home with just a nugget, just a minute, if I will call it elevator pitch. What would that take home be? Let me start from the high chief.
Yes, mental illness is a reality. It can be caused by situation. It can be chronic in that the person has chemical imbalance. Once life is not going the way it used to be, is a red flag, is a sign that something is wrong. If your family member suggests to you to go and see somebody, to go and see what is going on with you, we encourage you to go. Mental illness is like any other illness. If somebody is sick with malaria, they go to a doctor. If somebody is having stomach pain, they go to a doctor. If somebody's having eye problem, they go to a doctor. The same thing with mental illness. It is chemical imbalance in the brain. It is treatable. Some situations are not people being crazy. Some situations are not mental illness. Some situations are situationally caused. In other words, you can go and sort it out. Before you go somewhere else, go to your primary physician, go to your counselor, and see what is really going on. And listen to people. Once they say, this is not the person I used to know, take a chance. Go and see. Go and find out what they see that you are not seeing. Maybe that will be a beginning of recovery. Thank you.
Awesome, awesome, awesome. Thank you so much, Dr. Selena.
My major thing is stop stigmatizing mental health. Mental health, as High Chief said, it is real. And it is so real to the fact that it can affect you physically as well. If you are not taking care of yourself, if you're not doing your basic needs, you are not going to be well physically. It can cause other things, it can cause other stressors. So please seek help. If you see your family that's struggling, please ask questions. Don't be afraid, because the highest bipolar patients, people who have bipolar that are undiagnosed, or people who have depression that are undiagnosed, have a high chance of committing possible suicide. So we want to prevent these things from happening. Please stop stigmatizing mental health. This is real. It's just like diabetes and high blood pressure and any other chronic illness. So we need to make sure that we are looking out for each other. Look out to your family members. Make sure that you ask questions. If you see something that's off with your family member that's not normal, then say something. Do not be quiet, because you never know what people are going through.
Awesome, awesome. Thank you so so much. Wow, what a great session. I wish I can reach out to you guys like this and just give you each of you $10,000 check, because 1 hour program, I think it's just like I really really paid for this session. Thank you so so much. So, Mr. Alex, as I always say, you represent the audience and myself. So,
Yeah.
what would be your
I want to start by saying that I'm so excited. I'm so impressed. They are very wonderful. They're amazing people. I've learned a lot, and I think I can even lecture on this topic now after listening to these guys. However, I want to go with three things, which I will continue to expand. Stigmatization has to be avoided. The mental health has to do with situational cases and chronic cases, which has to do with chemical imbalance. Once you begin to notice abnormality around somebody with you and everything, you move to your counselor, you move to your family care. I think it has been very wonderful. I enjoyed the program, and I want to believe those I represent also enjoyed it. You are wonderful. Thank you very much.
awesome, awesome, awesome. Once again, my name is Emmanuel Adigbola, and I'm so excited that I was part of today's show. And please don't forget also the role of God, even in your mental health. When you notice that something is not right upstairs, talk to the man upstairs. Maybe the man upstairs can take care of your upstairs. Over to you, the host of the show, Dr. Kina Omineko. God bless you.
Thank you. What a show. Another wonderful show. I want to thank Dr. Selena and Saraidi also for this wonderful presentation. And to all our audience, like everybody said, mental health issues are real. Most times they are not your neighbor or your father's father or your grandfather's or somebody doing it to you. There is medication, there is therapy for everyone who is suffering through mental health, you know. And another thing that we all don't realize is that once a family member has a mental health issue, it affects every family member, you know, and that goes to your functionality, your everyday activity. Everything seems to be put on hold. So the earlier we start treating these people, the better for the whole society. Thank you once again, and we'll see you in the next 2 weeks for another show. Thank you.